I'm Dr. Sugar, your internet doctor, here to continue our discussion on understanding bronchiolitis. I will go into a lot more detail on who gets bronchiolitis and what the symptoms are and also what the risk factors are. So if you're ready, let's get started with a dose of medical inspiration. Each year, up to 125,000 infants are hospitalized due to severe RSV disease. Remember, this stands for respiratory syncytial virus. And about 1% of these infants die. Infants born prematurely, those with chronic lung disease, and those who are immunocompromised, as well as those with certain forms of heart disease, are at increased risk for severe RSV disease. Bronchiolitis is seasonal, and it appears much more often in the fall and winter months. It is a very common reason for infants to be hospitalized during winter and early spring. It is estimated that by the first year, more than half of all infants have been exposed to RSV. Let's talk about the signs and the symptoms of bronchiolitis. Bronchiolitis begins as a mild upper respiratory infection that over a period of 2 to 3 days can develop into increasing respiratory distress with wheezing and a tight, wheezy cough. The infant may begin breathing very, very rapidly, very fast, and if he or she is having some difficulty with breathing, they may also become quite irritable or anxious looking. If the disease is severe enough, the infant may turn bluish. This is called cyanosis, and this is an emergency. As the effort of breathing increases, you may see the child's nostrils flaring with each breath. And you may also notice the muscles in between the ribs retracting. This is called intercostal retractions. Essentially, when you pull the baby's shirt up, you'll notice that the muscles, the skin in between the ribs, is actually being sucked in between the ribs. This is called retractions, and it is a sign that the baby is having to use many, many more muscles than usual in order to just breathe. This can be exhausting for the child, and very young infants may become so tired that they have difficulty maintaining breathing. They don't have a lot of reserve, and when they become tired, this is a medical emergency. Now, the cardinal symptoms are bluish skin due to a lack of oxygen. Again, this is called cyanosis. Coughing, wheezing, shortness of breath, or even difficulty breathing. They can also have a high-grade fever, and those retractions that I talked about, the intercostal retractions, where they're using all those muscles just to breathe. Nasal flaring in infants, and also that rapid breathing. Sometimes they can breathe as much as 60 times or more a minute. So, if you see these cardinal signs, get your baby into the doctor. Signs that your doctor will look for in the office will include decreased blood oxygen. They'll do a pulse oximetry and check for decreased blood oxygen. They'll also listen to the chest with their stethoscope for wheezing or any crackling sounds in the lungs. The doctor may recommend some tests to be sure about what disease is causing this. These tests commonly include a test for RSV, and they may also include tests for other viral nasal cultures. Those can determine if perhaps there is another virus present if the RSV test is negative. Remember, there was 3 other viruses that can cause this: the adenovirus, the influenza virus, and the parainfluenza virus. So, they may also do a chest x-ray, and they may also, rarely, but if the infant is severely sick enough, they may also possibly order blood gases, which is a test of the blood which checks the oxygenation actually inside the blood. Okay, so there are some warning signs that bronchiolitis has gotten more severe, so let's just go over those quickly. If a child diagnosed with bronchiolitis is exhibiting any of the following symptoms, I want you to call your healthcare provider immediately or go into the emergency room. These are the severe symptoms of bronchiolitis. If the child becomes lethargic, meaning they're laying around, sleeping all the time, you're having difficulty waking them up, lethargy, that is a cardinal emergency sign. Okay? If they develop a bluish color in the skin, nails, or lips. If they develop very, very rapid but shallow breathing. Or if they have difficulty breathing. If they're flaring their nostrils or retracting those chest muscles in an effort to breathe, these are signs or symptoms that bronchiolitis has gotten quite severe and that hospitalization may be necessary. So get your child in for evaluation immediately. Now, certain children are at higher risk for getting severe bronchiolitis. So let's go over the risk factors for developing severe bronchiolitis. These include being exposed to cigarette smoke, being younger than 6 months old, living in crowded conditions, an infant who has never been breastfed, or a premature infant who was born prior to 37 weeks of gestation. Also, an infant with decreased immunity due to any compromising condition of the immune system. All right, so if the diagnosis of bronchiolitis is made, what will be done? I'm Dr. Sugar, and I want to invite you back to join me for part 3 of my Medical Inspiration video series on understanding bronchiolitis, where we will discuss just that. In the next section, you will learn much more about the treatment of bronchiolitis, so make sure to check it out, and I'll see you there.
Sugar.